Yes. Honey, I'm gonna turn my camera off, okay? Okay. Because I'm about to do something I shouldn't be doing. So I'm gonna turn my camera off, okay, baby?
They haven't looked into meningitis. No, I told them to. I told them because the HHV6 Foundation told them that I could have meningitis because I have reactivated HHV6, which is human herpes virus 6, type A.
See, I've got 1 and 2. I got herpes simplex virus 1 and 2.
Yeah, but they're dormant, probably.
No, mine actually came about when I first started getting sick. Mine actually, both of them came out. When I first started getting sick, they both came out. Like my parameters for that were really high, so they got reactivated. Probably because of COVID. Sweetie, is there anything food-wise that you're craving right now that you could eat? Is there anything that you're craving? No? I was just going to say, if there's something that you're craving right now, maybe your parents can order it for you or go pick it up for you. That way you can get some kind of food in your system so you can have some kind of energy, honey.
You know they won't do that. Let me message you real quick.
All right, sweetie. You guys. I feel like I just texted you, sweetie. I'm not gonna say what I texted you. That's only for you to read. Okay?
You did?
You didn't have the COVID shot, did you? You did? Oh no. When did you get it?
My cardiologist told me to get it because I had heart issues.
Oh man. Oh. Are you kidding me? Lovely.
I do have a fundraiser, but
You can, you can link it on here, honey.
I don't see the point. I'm really depressed right now. Your cardiologist said he did not. My cardiologist said yes. What happened was before I even got COVID, I was rushed to the hospital because I was having my heart rate was almost 300. Yes, I know. That's insane. Yes, I had to it was like an emergency. I had to get I was put on heavy duty heart medications after that. I also have mitral valve prolapse. I have mitral valve prolapse and super SVT real bad. But I haven't had that issue for a while. And then I got COVID. And then I had blood pressure issues. My heart rate was going high. My blood pressure was going high. And so then they put me on losartan to bring my blood pressure down. Anyway, I had POTS and I had dysautonomia. And then so my cardiologist said because of what COVID did to me, that I needed to take the vaccine, and then I did, and then, yeah.
Yeah, don't ever listen to the doctors when they say, oh, you need a COVID vaccine. Don't ever listen to them on that. Yes, the heart rate can go up that high, you guys.
Yeah. It wasn't 300. It was almost 300. It was so high. Like, literally, my dad rushed to the hospital. They called my dad. My sister rushed to the hospital. And you know that means it was bad. And basically, yeah, I was put on Cardia XT, which I love. It was really great. It really helped me. The Cardia XT, and potassium.
Have we ever had a chemical stress test?
A what?
It's called a chemical stress test.
No.
I'm surprised your cardiologist didn't do that.
Not that I know of. I never heard of it before.
Yeah, I'm surprised your cardiologist didn't do that.
Yeah, I'm not on losartan anymore, but I was on that. I've had a lot of heart issues, but they keep fluctuating. Like, it's weird because first I used to have really low blood pressure, and then I developed POTS and high blood pressure, so I was put on losartan. And then my blood pressure dropped, and I was put on midodrine to bring it up. And then now just like my POTS disappeared, and now just recently, my lower number is high. It's weird. I'm not on any heart medication right now, but that's why I see not cardiologist.
Yeah, and they're saying nuclear. I got it mixed up with something else, you guys. But yeah, it's nuclear stress test. My mom just had one done.
I've got this on right now.
Oh, you got a heart monitor?
Yeah.
Have you had to send anything?
I'm just pressing the button.
Just pressing the button? Okay,
Yeah.
because I had one of those for 10 days. And my cardiologist was not concerned that my heart rate went up to 178. He wasn't concerned. And I'm like, that would concern me.
Too high.
Yeah, when I'm just literally standing in my kitchen and my heart rate goes to 178, that's concerning.
It is concerning. My issue right now is not my heart rate going too fast, because my heart rate, it's pretty okay. It's that it skips beats and double beats. And I have chest tightness.
Mm-hmm.
And then real lightheadedness, like I'm going to pass out. And I don't know what it's arrhythmia, but it's not that it's going too fast.
Mm-hmm. You're having like skipped beats.
Yes.
So to speak. Honey, keep that oxygen on you, please, baby. AF, atrial fibrillation. I think that's MPPCs, yeah.
My dad is actually, that's what he does for his job. He's an engineer, and he invented the surgical instruments used in heart surgeries.
Really?
Yeah, on people with AFib.
That's funny because my dad's an engineer as well, but he created the satellites for the military that they test out in Mexico, in Juarez, Mexico. Yeah.
Oh,
Yeah, he helps build, well, he's retired, but he helped build the satellites that helped with the military out in Mexico.
yeah, my dad has some of his those are his, I don't know what you call them. For his,
Degrees.
no, that's his inventions.
Oh, okay.
The
Okay.
surgical instruments.
Oh, okay. Got you.
Um, see what you wrote me. What's a loop recorder? Do you have to have surgery to get that? Because I don't handle anesthesia well.
I don't know what a loop recorder is. A nurse is in here. Do you think she would benefit from a TENS unit as long as she doesn't put it up really high? Can't they implant a TENS unit? To help control her pain? My mom's got a TENS unit.
Gangsta Granny. Okay.
I texted you the
We'll
Okay,
see.
thank you.
Sometimes it echoes.
Hi, sweetie. I'm a grandma, by the way, of 14 kids. Oh, wait a minute, 15 kids. I got 15 of them now.
Oh my gosh.
I have what's called a spine stimulator that's in my back. Yes, it is a TENS unit. And it is a marvelous thing. Some people say different. Yes, I know. To all you guys in the chat that might think different. Mine has been wonderful for me. It helps with my pain. I suffer from extreme pain
It's
all my life.
It's implanted in your back, right?
Yes, it is. It runs up my spine. But it
Doesn't
helps
it
with
like
my
control
pain.
doesn't it control all the nerves related to the spine, and you have like a little remote control where you can dial up the usage
Yes.
on it and stuff?
Now the new ones, mine is controlled with the remote control, but I got mine 5 years ago. I've had mine for 5 years. And I've loved it from day one. What they do is they put a temporary one in for a week and you see if you like it. And if you like it and your body tolerates it, that's the two iffies right there. One, if you like it, and two, if your body tolerates it. And if both of those are a go, then they permanently put it in, and you have a battery in your upper hip where you charge it. And as my granddaughter loves to say, Grandma has to charge her butt at the top of her lungs. Oh yes, it's the ongoing joke. She was 3 years old when I first got when she first got to see that I was had to charge it. So it was her funny thing. But it's wonderful, and it until the battery runs out. But I love mine to death. And two of my friends ended up getting one because of mine, and they love theirs. But theirs runs off their phone, and they just recently got theirs. One got it a year and a half ago, and his wife just got hers, and hers runs off her phone. But they are wonderful, and they do help with the pain. But have you tried Epsom salt baths? Sitting in a tub of Epsom salt?
In the past I did, but I can't go upstairs anymore. I can't walk up there. I don't even think I can sit in the bath. It would hurt. I don't know.
So the bathtub is upstairs? Okay.
Yeah.
Yeah, I've been suffering the last year. I have been having severe pain down my right leg, and the doctors cannot figure out what's going on there. And that's one thing that's similar to what's going on with you. So I feel you on that, because the doctors can't figure out what's going on there. And what it's come down to is the last time that I had injections put in, one of the shots missed. And so I've got nerve damage from the injection, that instead of it going where it went into a nerve and has damaged the nerve. So I'll just have severe pain for it for the rest of my life. But check with your doctor. Do you have a pain doctor?
No.
Or do you have your primary doctor could probably hook you up with someone to talk to about getting a pain stimulator. Who manages your pain meds?
Nope, I don't have pain meds. I don't have any doctor managing anything.
That's not good.
Nope.
Yeah, I think you would benefit. You could actually get a TENS unit from like Walmart. You can get one from there. You can buy them at the store.
Yeah, I've gotten them.
That's what I would use.
My pain is different though. It's not just pain, it's accompanied with lightheadedness, passing out, heart palpitations, shaking, weakness. Like literally, right. It feels like I'm going septic.
Right.
Can I explain to you why it's doing that though?
Hmm.
Because when you have pain, your body
It's
perceives it as like an attack on your body. So you're going to get like quote unquote the anxiety type symptoms. Your heart's going to start racing, all that other stuff, because your body's going to perceive it as a threat. So it's
right,
going to
and your body's trying to fight it off.
yeah, it's going to go in that fight or flight mode because you're in pain, and it sees that pain as a threat. So it's going to start going into that flight or fight mode, and so all of your body systems are going to start ramping up.
That's why your heart rate goes up. That's why your pulse goes up. That's why you get dizzy. That's why you get sick of your stomach. Do you know how whenever you get a headache, your eyes might get blurry, or your nose might kind of get stuffy, or something like that? That's because your brain is sending signals out. It's the same thing. If you cut your finger, you might see the blood and then feel the pain. It's the same issue. It's different brain waves going at different times. But if you use a TENS unit, if you don't have any pain meds for this pain and you're not managing this pain, that TENS unit is going to help with that nausea and that dizziness and your blood pressure fluctuating.
You mean the ones that you just buy?
Yes.
Yeah, but how can I get it to vibrate and work on my entire body and all my joints?
It comes with little pads, and you space them out.
Yeah.
You can put one on your shoulder, and you can put one on each shoulder and one knee, and space them out, and you can make that space pretty big. And it depends on, and you can set the level of intensity as to how much you want it to be. If you want it to make you bounce off the bed, you can put it that intense. Or you can make the jolt that much. If you just barely want it on, you can just barely have it on. But I think that you would benefit from it. I think it would help you eat too.
Yeah, I don't know. I've used them before, and it didn't do anything.
You got to have the right mindset too.
Oh, you're supposed to have this.
And you see that name under my little cute picture right there of my cup, that gangster granny?
Yeah.
I'm up late. I'm up late every night. If you're feeling down, I'm going to actually go to your profile and I'm going to DM you my number. Okay? If you need to talk to somebody, you send me a DM or you send me a text. Okay?
Thank you.
I will be here when you need it.
Yeah, I text her every day to check on her. Like, every day.
I will be that grandma that I guess I have another grandchild. I've got so many I can't count them anymore anyway. One more ain't gonna matter. But yes, I think a TENS unit.
That's why I had mentioned it, the TENS unit, because it just came to my brain. I'm like, what about a TENS unit?
I have one.
I know I've had one on my wish list. Because the one I have at home, somebody gave me that I found on this like a neighborhood app, like a neighborhood giveaway app. It's pretty old, but it's hard to eat, you guys.
Well, I will send you my phone number, and you can use it when you need to. No, let me rephrase that. You will use it daily. Grandma said so.
Thank you. Where do you live? I forget.
Missouri. I am way away from you.
Yeah.
Or I would be there. Making sure you got to where you needed to go.
Like what?
Your, whatever these are called.
You should tell me. What is it?
Dr. Bowman prescribed them. You were there.
Prednisone?
Yeah,
She told me to take 2 of them?
that's the directions. 2 for 3 days. 2, 2, 2.
And then 1, 1, 1?
And then 1.5. Try to break those up.
Steroids? For what?
And that's what I'm curious about too.
It might affect my mood. Just so you know. Because I do.
Yeah.
But
Olivia,
I'm just wondering exactly what they prescribed it for her for. Yeah, I know it's a steroid, but I want to know if they prescribed it for her for the pain or for an infection, because they use it for infection as well. Did they prescribe that for your pain, your
Inflammation?
or an infection?
To bring down the inflammation.
Okay.
Where's the inflammation at?
My joints.
Okay.
Anyway, that's what she said. We'll just try it.
No, it will help.
It will.
It will help.
What's on my face?
Skin.
What's
Yeah, the prednisone will make you mad hungry. Might keep you up at night too. I wouldn't take it close to bedtime because it'll hype you up. So I'd take it in the morning with. You definitely want to take it with food though. I mean, any medication, unless it says not to take it with food, you always want to take it with food. Are you eating you some pancakes, honey?
Yeah.
And another thing, what I need you to do when you take this prednisone, You need to start monitoring your heart. I know you have the heart monitor on, but start
Here, I'll let you
monitoring
see
your
me.
heart.
Hi.
See, I'm an old granny, just like I said. I'm not really a gangster, though.
But yes, definitely please monitor your heart rate after you take the prednisone too, just to make sure it's not doing anything. Even though, yeah, I know you have heart monitor on, but you need to be taking care of like how your heart is feeling too, like measuring your heart rate and stuff, because it amps up the body.
Yeah, mine's in my chest. Because I can't have the stickers on me. I'm allergic to the adhesive.
Oh, the heart monitor?
Yes. I go tachycardia and bradycardia all the time. My heart don't know what it wants to do. It wants to dance around. So it's called a loop monitor, and that's what it does. So basically, the heart monitor that you have on basically is the heart monitor that you have affixed to your chest basically is the same thing as what's inside my chest. Except mine's like a little bitty diode thing.
Yeah, Mom had to have a pacemaker put in 2 years ago.
My husband almost had to have a pacemaker. He tried. But the doctor said that he wasn't going to allow my husband to pay for his son's college yet.
Yeah. Oh, and another thing, Laurah, honey, the prednisone might make you sweat. Some people have sweating with it, some people don't. So if you start sweating with it, that's one of the side effects. I didn't when I took it. I just had like energy and a high heart rate. So.
I'm having some really bad depression right now, sorry.
Honey, trust me, your feelings are valid.
But you know what? All of this that you're going through, think about it this way. There's a saying that I say, all of my diagnoses are a part of me. They don't define who I am. And that puts a smile on my face every day. They might bring me down. They might make me hurt. They might make me sad because I can't do what I want to do. But they don't make who I am. They don't make that person that I am. So turn that frown upside down.
I just
And
need
put
to
a
get. I need to
smile.
get out of this whole like it's immediate danger. Feel like I'm dying situation. Like I need to be able to at least eat and move a little bit and not be having heart issues. And I need at least to stabilize a little bit so that I can at least, because this doesn't feel like a chronic illness right now. It feels like I'm in like immediate need for medical attention. Like something's very wrong. But I can't even get out of this situation. I don't even have a diagnosis. I don't even have. I mean, I do, but old diagnoses that.
What is the diagnosis that you have right now?
The ones that I have, but that's not what this is. I just want to be clear. That's not what this is. I don't know what this is. But I have fibromyalgia, Ehlers-Danlos syndrome, SVT. I have secondary porphyria, which might be primary porphyria, but I don't know. There's no porphyria specialist here. It's difficult to diagnose. I have something going on with my uterus, and my uterus needs to come out. I was diagnosed with Lyme disease, but that's all. That was out of state. The doctors here don't acknowledge it, and they definitely don't hospitalize you for it, and they don't do anything for it. I was peeing out. I took a mold test, but this mold test I took was 2 years ago, a urine test. And I had high ochratoxin A in there, which is toxic and can cause Alzheimer's and kidney issues and everything. But the thing is, that mold is in food. So it could be very well that a lot of people have it in their bodies and they're fine. So I don't know.
I got a mold culture being looked at right now.
I think Maddie left. I told him he could come, but I don't know how to send invites. He would have to send an invite. I think he left.
And what's going on right now?
My whole body's shutting down. It started with respiratory distress. And I was having partial paralysis, like periodic paralysis in my, especially in my feet and my hands. And then this side of my face getting numb and tingling, and then I can't move it. And I'm having respiratory distress. I was passing out with severe kidney pain, very dark urine. I was having high ketones in my urine and my blood. My blood sugar was spiking into the, 250s. Basically, I was like, my body was like shutting down, going into shock, and I couldn't move, and I was the most painful thing I've ever experienced, and scary. And that's what it started with, and then I slowly started getting more burning. It started in my hands and feet, and then it's been spreading up my legs, and these bone spurs started growing.
Have they checked you for pandas?
They haven't checked me for anything recently. The last lumbar puncture I had was 2 years ago. And I did have high protein in my urine. Hi, Vicky. Not my urine, my cerebral spinal fluid. I'm just a mystery, and my brain scans look just like a neurodegenerative disease. I've complete muscle wastage. It's not from being in bed. I'm in bed because of the muscle wastage and the pain. So and the respiratory distress and everything.
Have they broken down your actual MRI or CT scan of your brain?
Everybody just, Christy, they just completely blow me off.
I want copies of, I want physical pictures of these scans if it's possible.
The only physical scans I have are from New York, because they keep them on your My Chart. I don't have access to any of the other ones that I've ever had. But yeah,
Because I want to take a look at them, like the actual picture, not the report, but the actual pictures.
I basically feel like I have the worst flu of my life, mixed with, I'm just saying this is what it feels like. I'm not saying I think I have this, okay, guys? I'm just saying this is what it feels like. It feels like I have the worst flu virus of my life, mixed with, bone cancer, mixed with AIDS.
I get that.
That's what it feels like.
Okay.
I just needed her for a second.
Okay. Because I've got a friend on here that actually can read those results pretty well.
Sorry about that.
Oh, you're good. She's got, she can read, she's, the invisible diagnosis is her name. If we can somehow get copies of like those scans, not the report, but the actual copy of it, like the visual copy of it, I can send it to her and she can look up some stuff for you.
Okay. I can send a picture of the pictures.
Yeah.
A screenshot.
Yeah. Yeah, that's fine.
Oh, okay, hold on 1 second.
Okay, and I texted you. I don't know why it's not going through. My phone's being weird.
Yeah, she should have full access of her medical chart.
Yeah, well, sometimes like to get the actual pictures though, you have to like get them put on a CD. Like that's how I have to do
My
it.
portal.
I'm sorry, what?
My portal. The portal of my. I'd have to check on that before I say that. But I think on the portal, I think I can see the films.
Okay. And honey, I texted you back. My text isn't going through. It's still like pending, and I don't know why.
And that's the thing. My head is pounding, and not like a headache.
It's like head pressure. Almost like your head is like in a vice and somebody's just cranking it and then
It's like
releasing
my
it.
brain is on fire,
Yeah.
and it feels like someone hit me in the back of the head, and I have a concussion.
Yeah. That was actually one of my first symptoms that I had when I first started getting sick. And it hurts. And it's so annoying. They did. Allie, they're doing an ANA, and I think they might be doing a CRP and possibly a PCR. Hopefully they do the CRP. Huh?
I've had ANAs done before, and this is all that comes back. I have positive ANA speckled pattern. I have a positive atypical PANCA, atypical, and everything else is normal.
But see, that's... I don't know why they won't look further into that, because that's something.
Right.
They won't look at anything. I'm telling you, I'm being treated like, I know nobody believes me, but like, I'm being treated really weird. It's just really weird how they're treating me. Like, it's so inhumane. I can't get anybody to want to look into things, except for the cardiologist that I saw, like, because, I mean, that's pretty straightforward.
Yeah. Yeah.
My head hurts so bad, it's just like in the back.
How old are you?
36.
Young.
Yeah, she's younger than me, too.
I feel
You're the age of my kids.
And see, the thing is, if you can get to like Johns Hopkins, they have all these specialty doctors. You'll have like a team, from
Right.
each area that you need. You'll have like a full team, and each
Or a Mayo
like, will
Clinic.
run
What about a Mayo
something.
Clinic?
They won't accept her.
I just shake my head.
And see, that's the thing. If she was get admitted in a hospital, like a whole local hospital, they do that. They have a team of doctors because that's what they did with me when I had sepsis. They had a team of doctors come in
Right.
because it
But the problem
affects
is getting her admitted.
exactly because sepsis affects every single part of your body, but like it just it, I don't know. I'm just beside myself with these damn hospitals. It's like what me and her were telling each other through text the other day. We wish that these doctors could climb inside our body just for 5 minutes.
She's in a lot of pain, Sophia. She's
Just
just
climb inside
down.
our bodies for one day and see what it feels like.
I called Mayo Clinic last year before I went to the nursing home. They won't take me because of my insurance. And my mom and dad were even like, is there a way that we can, raise money and pay for it? Can we just pay cash? No, that's not allowed. It's against the law.
See, I don't know why they said that.
You're not allowed to accept payment from somebody who is on, I don't know if it's Medicare or Medicaid, but whatever the one I'm on. They're not, doctors and whatever are not allowed to accept money.
What?
That is so odd to me because
I forget the way my dad explained it, but this isn't the first time that they cannot accept me. Like, I would have to switch insurance. I don't know to what. Like, I would have to. If they don't accept your insurance and you're on government assistance, you are not allowed to pay. You just cannot go there.
That just doesn't. I think you were misinformed.
That's what I'm thinking. I think you need to check into it again. I think you got on the wrong somebody.
Yeah, because that's not what they told me when I
But
called.
this isn't the first time that's happened to me, because even when I was younger, and I was on Care Source, if you know what that is, I was on Medicare. Now I'm on Medicare and Medicaid. I'm on both, but I was on Medicare, and that's when I was needing surgery. I was having adhesions from my bowels were all twisted and stuck together, and it was really painful. And we wanted to see a specialist and for exploratory surgery to, burn the part that adhesion. They said no, we can't because she's on Care Source. And my dad at that time offered to pay out of pocket. And he said no, can't accept your money. So this is not the first time that this has happened.
I think they're giving you false information because literally when I called them, they said, yeah, it'd be $5,000 out of pocket because we don't accept state insurance. Somebody's not telling you the truth. Somebody's not telling you. You need to call them back. Somebody is not being right with you.
Right.
And honey, did they ever rule out endometriosis?
Well, my last surgery, she didn't see any.
Okay.
Back in 2021.
They didn't see anything in your because it's in your uterus, honey.
I was getting my left ovary removed.
And they didn't see anything? Okay.
I do have adenomyosis. I was already diagnosed with that. Yeah, I do have that.
Yeah, I've got that too.
And yeah, my pap smear showed significant inflammation. Is just what it says on the report.
You got inflammation everywhere. It makes me think back to like a mold situation.
I don't know.
Yeah, I know.
I don't have a lupus rash on my face. Like, I don't have a butterfly rash.
You don't have to necessarily have that though. Some people don't.
Here's what I do have. I do have optic nerve swelling, edema in my eyes, in my disc, my eyes, which is a sign of lupus.
Yeah.
But maybe it's not. I mean, because my lupus panel was normal.
It was.
Yeah.
But see, the thing is, honey, sometimes it takes
Daughter-
years for somebody.
Her daughter-in-law has lupus and no rash.
Yeah. Sometimes
So-
it takes years for somebody to get diagnosed with lupus. It's a very hard disease to get diagnosed with. Very hard.
What about Graves?
I don't know what that is.
Graves.
I don't either.
Okay, so Graves' disease deals with your thyroid. You got Hashimoto's, and then you have Graves' disease. Hashimoto's is more like on the low end. Graves' disease is now chat. If I'm wrong, please correct me. People in here that do have these. If I remember correctly, Graves' disease is an overactive thyroid, and Hashimoto's is an underactive thyroid.
My thyroid's perfect.
Yeah, but
I've had it checked. The TH3, or whatever it's called, the T3, the T4, the free T3 or something. That's all good.
okay, thank you, butterfly kisses. Yeah, Graves' disease is hyper, Hashimoto's is hypo. So one's overactive and one's underactive.
Hmm.
Something's because you had a positive ANA. Something autoimmune is going on. Something autoimmune is going on.
That's what my neurologist said, but she said it's not her thing.
No, you would have to go to see an endocrinologist you would have to go see an endocrinologist and a rheumatologist. They deal with all that.
I haven't seen a good rheumatologist because I can't get in. Like, they canceled on me just last week.
Yeah, you can see an immunologist too. They're good. So all three of those would be good to see.
Immunologist. I can't even say it.
Immunologist. They deal with just the immune
My
system.
tongue's been twisted. My tongue's been twisted for a little while now.
Right.
I can't reschedule because she said she won't see me. She said she can't help me.
Well, you know what? The next doctor you go to, honey, and they look at your chart, and if there's something in there that you don't want in there, by law, they have to remove it. If you say, I don't want this in my chart anymore, they have to remove it.
They can't remove a diagnosis. They gave me a diagnosis of malingering. So when I was in the hospital.
But what I'm saying is, if there's something like anxiety or depression or like an eating disorder, because they have that on mine, but what they don't understand is it's hard for me to eat. But if there's something on there that you don't want on there, you need to talk to your doctor and have them remove it. If it's not true.
That is true.
I'm not feeling good.
You want to rest, honey?
I gotta get off here. I'm not doing good.
All right, honey. You
I
can.
don't feel well. I need to be in the freaking hospital. This is insane. I need to be in the hospital. This is insane.
We can drop off if you want to end it, honey.
Yeah.
Okay. Okay. You can text
All right.
me.
I'll send you my number, okay?
I'm not going to talk to you out. I'm not going to talk to you out. I can't go back